Hi, I'd like to welcome everyone to our session on what is response to intervention. My name is Tessie Rose Bailey, and I am the co-coordinator of technical assistance at the National Center on Response to Intervention. The National Center has a definition for RTI that includes what we consider to be the essential components. You'll see at the first part, response to intervention integrates assessment and intervention within a school-wide multi-level prevention system to maximize student achievement and reduce behavior problems. I want to point out that one of the main things here is that it is a school-wide intervention system, prevention system, as opposed to a pre-referral for special ed. And it is multi-level as opposed to multi-tier. And I'll talk more about that a little bit later. But when we think about levels, it's increasing levels of intensity to prevent school failure. The second part of the definition really highlights what are our essential components. So if you'll see this, within RTI, schools identify students at risk for poor learning outcomes. In other words, screening. So we're screening students who need additional support. The second part is monitor student progress, which is pretty self-explanatory. And the next part is provide evidence-based interventions. And that's where we look at our multi-level prevention system. And the last piece is adjust the intensity and nature of those interventions based on student responsiveness. Or, in other words, data-based decision-making. RTI may be used as part of the determination process for identifying students with specific learning disabilities or other disabilities, and that is really in accordance to your state law. I really want to highlight that RTI is a preventative framework. If it is just a pre-referral, then we wouldn't really consider it to be RTI. It is multi-level instructional framework aimed at improving outcomes for all students, not just students who are at the highest risk or in special ed. It is preventative and provides immediate support to those students who are at risk for poor learning outcomes. And preventative is really, like I said, the key word here. So, and then providing immediate support to students who are at risk. RTI may be a component of comprehensive evaluation, and I recommend contacting your State Department of Education on your disability laws. So as you saw in the definition, the center has identified 4 essential components for RTI. The first is a school-wide multi-level prevention system. And within that prevention system, we find 3 levels of support. The first is primary, which is more of your core instruction and curriculum. The second is secondary, which is in addition to your primary and provides supports targeted at that student's needs. And then your last support, which is more intensive, is tertiary. That is also supplemental to primary. And I'll talk more about this in detail in a minute. The second component is screening, followed by progress monitoring. And a lot of people say, well, shouldn't you just say it's an instructional system and then you have an assessment system? Screening and progress monitoring have 2 very distinct purposes within an RTI framework, which is why they are put separately within the conceptual model. The last piece is database decision-making, and at a minimum, that database decision-making is looking at instructional decisions at a multi-level movement between the tiers or the levels of support that you have within your system, and, of course, disability identification in accordance to your state law. The center has developed a graphic to sort of highlight what this framework is, and many of you are probably used to the triangle with the red, green, and yellow to highlight RTI. But really, we see that triangle as falling into one of the essential components. This framework takes into account all of the essential components, and most importantly is the use of data to make decisions. So if you look in the far left, you will see screening, and then to the far right, progress monitoring, and obviously at the bottom, the multi-level prevention system. These 3 components are really based on data-based decision-making. If those components are in place but data isn't used, then it's not really RTI that's being implemented. If you look in the center circle, what you will see is a culturally responsive, meaning that the screening tools, progress monitoring tools, interventions, data-based decision-making procedures are culturally responsive, as well as on the other side, the evidence-based. And on the outside of the circle, you'll see that when those things are put into place, we would expect improved student outcomes. I'm going to talk about each essential component in a little more detail. The first one is screening. The purpose of screening is really to identify those students who are at risk for poor learning outcomes. And those outcomes could be anything. Because if you think about RTI, it is a framework in how we provide services. So it could be poor learning outcomes in math, behavior, reading, writing, health, speech and language. It's really how it is being used within a particular school and what are the needs of that school. The focus is on all students, not that just sub-students who people think might be at risk, but this system of screening identifies those students who might be at risk. It is not diagnostic. It just indicates that this might be a student who might need additional assessment to find out more or additional support. The tools should be brief assessments and obviously valid, reliable, and demonstrated diagnostic accuracy for predicting learning and behavioral outcomes. Most importantly is this tool should be able to more accurately identify who could be at risk. There is nothing that's 100% perfect, so you're going to over-identify students a bit, and that's why additional assessments for those particular students may be needed. The time frame is administered at least more than one time per year. We recommend fall, winter, spring, and that's commonly used with most of the tools that are on the center's tool charts. Screening, in addition to identifying those students who need additional support, can answer a couple questions. For one, is the core curriculum working? Does what we're doing in our primary level prevention system work for the majority of our students? And most people seem to say 80% of students are benefiting. Is the instruction that we're using effective for most students? And then obviously, which students need additional assessment and instruction? Remember, they're not diagnostic tools, so they don't necessarily tell you what type of intervention is needed. It indicates that these students might be at risk for poor learning outcomes and additional support or assessment is needed. The center has developed the screening tools chart, and you can access that on our website at www.rti4success.org. If you look at the left-hand side of the screening chart, you will see a list of tools that have been reviewed by the National Center. On the column next to it, under Area, you will find the name of those tools. And by clicking on those tools, you can gain more information from the publishers. The next 5 columns are looking at different indicators of how valid and reliable and appropriate these tools are for use within an RTI framework. That first part is classification accuracy and is really looking at how well does this tool identify students who are at risk for poor learning outcomes. At the bottom of the chart, you will see that there is a chart legend, and it tells you a full circle is convincing evidence, a half circle is partially convincing evidence, and an empty circle is unconvincing evidence, a line is no evidence. So users can use this chart to identify what tools are appropriate for the needs of their school. In the farthest part under efficiency, you will see 4 columns that provide information about how these tools are administered. Are they individual? How long does it take to administer those? Is there a scoring key? And are there norms and benchmarks? And those will be useful in helping a school determine if this is most appropriate. The center also has user guides that go along with this tool chart to allow teams to work through the process. So we've identified or addressed the essential component of screening, and we're going to move on to progress monitoring. Because in screening, you might identify students who are in need of additional assessment, and progress monitoring is recommended as part of that additional assessment. So the purpose of progress monitoring is really to monitor students' response to both primary, secondary, and tertiary instruction. So not just for those students who are receiving very intensive support, but any student who is identified as potentially at risk. And the purpose is to estimate the rates of improvement. So how much improvement are they making in comparison to their same age peers? Also, to identify students who are not demonstrating academic or adequate progress, as well as to compare the efficiency or efficacy of different forms of instruction. And the focus is really on those students who have been identified through screening as at risk for poor learning outcomes. The tools, just like screening, are brief assessments, and they should be reliable, valid, and evidence-based. The time frame for assessments, progress monitoring assessments, is really dependent upon the tool and then what is the typical rate of growth for this student. At a minimum, progress monitoring tools should be administered at least monthly. But if you think about how much data is required to make a decision based on data, we would recommend at least weekly or perhaps bi-weekly. Progress monitoring can answer a couple of questions. So for one, are students meeting short-term goals? And then as well as long-term performance goals. You may be working with students who are significantly behind their peers. And so you may set short-term goals to see if a particular intervention is working. But you really have long-term goals so that you can begin to close the gap for that student. You're also looking to see, are students making progress at an acceptable rate? Progress monitoring allows you to calculate the rate of growth for a particular student who is in different interventions. And then the last part is, does the instruction need to be adjusted or changed? There are data decision rules that allow you to use progress monitoring to say, this student is probably benefiting from this intervention and I can continue it, or this student may need additional instruction or his instruction to be changed. Just like screening, the National Center has created a progress monitoring tools chart. And this tools chart actually began with the National Center on Student Progress Monitoring, and so has been on the computer or on the website for about 8 years. Over time, a lot of research has been done on progress monitoring tools, so you will see that there are a lot more indicators than in the original progress monitoring tool charts. Just like the screening tool charts, you will see the name of the tools on the left-hand side, and in the second column, the areas in which those tools fall under: math, reading, or writing. And then the rest of the indicators are what research has said makes a good progress monitoring tool. Just like screening, there are user guides that go along with this tool chart to help teams decide which tools may be best for their school. So we've addressed screening and progress monitoring, which really are the assessment components of RTI. And we're going to move into the instructional components under our multi-level prevention system found at the bottom of the graphic. If you'll notice, this most important, and we've mentioned this before, is this idea of school-wide, meaning it's not just available, support is not just available for a select group of students, but is actually the way we provide services for all students. This is where the triangle that you're probably familiar with comes into play. At the bottom, you'll see the green, which is we consider to be about 80% of students. And in an effective system, that 80% of students should be benefiting from primary level instruction and curriculum. It is school, class-wide instruction for all students, and it includes pretty significant differentiated instruction. The second level, or secondary level, is supplemental. So students are continuing to receive that primary level, but also receiving supplemental supports. And those are through small groups, teacher-led interventions. And then our third level, which is tertiary, is for a very small group of students. And it includes specialized, individualized systems for students with intensive needs. If you find that in your school more or less than 80% of students are benefiting from primary level instruction, we recommend to focus on improving what is happening in the core instruction and core curriculum. Otherwise, your school may not have sufficient resources to meet the small group of students who need supplemental secondary and tertiary support. Primary level, as I mentioned, is for all students. It includes your district curriculum, instructional practices that are evidence-based. It doesn't mean that everyone is doing the exact same thing. What it means is that there is a core in which all folks are adhering to, and the outcomes are similar for all students. It aligns with state or district standards, and it really incorporates this idea of differentiated instruction. And it should be based on the needs, what meets the needs of the majority of the students in the school system. The setting is in the general education classroom. And the assessments that you might find used within a primary level include screening, which we've talked about, continuous progress monitoring, and outcome measures, as well as the measures that go along with the district curriculum. Under secondary level, you will see that this is for those students who are identified through screening as at risk for poor learning outcomes. The instruction is pretty targeted and focuses on what has been identified as the issue. Is it phonics? Is it math calculation? Is it comprehension? And it should be supplemental. And the group size is really important. And you want to look at the interventions you're using in secondary to determine which group sizes have been used with that particular intervention. The setting should be in the general education classroom or in other general education locations within the school. And that is really going to depend on the school system that you have. You may have to do cross classrooms, or you may be able to do all of that within a single classroom. The assessments at the secondary level primarily focus around progress monitoring, so we can look at how well students are responding to secondary level instruction. And diagnostic assessment may be necessary to determine which interventions or which areas should be targeted. Tertiary is the most intense level of instruction, and students who have not responded to primary and secondary level prevention may benefit from tertiary level instruction. It should be very intensive, supplemental instruction delivered in very small groups or even perhaps individually. And as I mentioned in the secondary, it really is going to be based on the interventions selected and what does the research say is effective for that particular instruction. We normally see between 1 to 3 students in a tertiary level small group. The setting is in the general education classroom or any other general education location within the school. And the assessments, similar to secondary, revolve around progress monitoring and perhaps diagnostic assessment. When we think about, well, how do we change the intensity and nature of the instruction from primary to secondary to tertiary? You could change the intervention, and in some cases that may be the most appropriate, but it is not always the only way to change the intensity of that intervention. You may change the duration and the frequency. So how frequently are you administering the intervention? Perhaps in secondary it was only administered 2 to 3 times a week, where in a tertiary it is increased to 5 times a week. The duration can be changed as well. So are we looking at 20 minutes per day as opposed to 40 minutes per day? In some cases it may be more appropriate to change the interventionist. You may have very well-trained paraeducators delivering scripted programs, and you may use more your reading specialist for those students who have very intensive needs. And changing the group size as well and can change the intensity and nature. Taking a group from 7 to 3 really changes how often students can respond and participate in interventions. And as I mentioned before, it really depends on the interventions that have been selected, and users must follow the protocols outlined within that particular intervention. The Center has released its instructional tools chart to help users determine which interventions can be effective within a secondary and tertiary framework, or an RTI framework, but secondary and tertiary levels. On the left-hand side, you will see the program that has been, the research that is evaluated for that particular program. And in the second one are the actual research studies that were evaluated. You want to pay attention to the study quality, so how good was the research that was conducted, as well as the effect size. So what was the change in growth for particular students using these interventions? On the Center's website, there is an easy-to-use video to show you how to interpret the tools chart, as well as a user's guide. So now that we have addressed the components that are in the outer circle of our graphic, we're going to move to the database decision piece. You can see that with your screening and progress monitoring data, you can make decisions about how you design your multi-level prevention system. And if you'll see with database decision making, there are arrows going both ways, meaning progress monitoring data actually helps with database decision making, and database decision making can help change what you do with your progress monitoring. And the same happens for all the core components. We recommend that data analysis is at all levels of RTI implementation, that it doesn't occur just at the student level. Schools need to look at the overall framework, how effective is the overall framework that is implemented, how well do different grade level curriculum and instruction work for most students, and then as well how do particular interventions work for students. We also want to look at different levels of prevention and make decisions in those. In primary, how effective is the core and the core instruction? How effective are additional supplemental groups within the primary instruction? And how well are we differentiating for a diverse group of students? With the secondary and tertiary, we may be looking at student level decisions, but also looking at how well do particular interventions work for the majority of students in secondary and tertiary. We recommend that there are established routines and procedures for making those decisions, and it's probably best to put those in writing so that as you have staff turnover or training new teachers, that they can refer back to these established routines and procedures. And that goes the same for explicit decision rules for assessing student progress. How will you know within your school or your district if a student is benefiting from the instruction that is provided as well as the RTI framework that is put in place? Schools can use that data as well to compare and contrast the adequacy of the core, which we spoke about, but also the effectiveness of different instructional and behavior strategies at all levels of prevention. We tend to see these as the most common types of decisions that schools make. Instruction, so how good is the instruction? What instruction is needed for students? The second one is the movement between a multi-level prevention system. How do we know when a student is no longer in need of secondary prevention or can move from secondary prevention to tertiary? Those should be outlined prior to the implementation of your RTI framework. And then that last piece is how do we know if this student should be referred and is eligible for disability identification? Although we don't provide guidance on particular states, we recommend that you contact your state department of special ed and determine what are the procedures for your state. The law states that to ensure that underachievement in a child is suspected of having a specific learning disability is not due to the lack of appropriate reading instruction and reading math, that groups must consider two things. The first one is that data demonstrates that prior to or as part of the referral process, the child was provided appropriate instruction in regular education settings. Screening data that looks at the growth rates of all students can help you answer this question. The next piece is data-based documentation of repeated assessments of achievement at reasonable intervals, really talking about your progress monitoring. And that data was provided and shared with the parents. So now we've looked at all the essential components: screening, how we identify which students are at risk; progress monitoring, how do we monitor if students are responding to the instruction and supports that we're providing; a multi-level prevention system, how do we meet their particular needs; and how do we use those particular components to make data-based decision-making. I want to close up by talking about implementing the RTI framework. It's easy to identify your model components, but implementing can be quite difficult and can take at least 2 to 4 years to get into full implementation. We recommend that you select and implement evidence-based practices and procedures. The tool charts available through the RTI Center can help you do that. You should also implement the essential components and identified framework with integrity. So it's not enough just to implement screening and progress monitoring with integrity. You also have to look at the interventions that you put in place, your core curriculum and instruction, as well as the procedures that you have put in place to make decisions. And then look at the overall framework and how that's been put in place. You also want to ensure that cultural and linguistic and socioeconomic factors are reflected in the RTI framework and its components. On the tool charts, there is a column that provides information about how these particular tools have been used with different groups, and I recommend checking those out. If you need more information, please feel free to visit us at the National Center on Response to Intervention. In addition to the tools charts, we have a number of webinars, resources that can be used, as well as our recent release of our Essential Components document, which is kind of like a guidance to what is RTI. The RTI Action Network also has a number of resources to help with implementation at both the district and the school level. And IDA Partnerships has good resources on talking about how to implement and move forward with RTI. If you have additional questions, feel free to submit them to the RTI Center. We will be doing an online chat following this, and I look forward to talking.
Thank you, Tessie. As Tessie mentioned, we will be hosting an online chat on September 21st at 2 p.m. Eastern Time. We invite you to submit your questions ahead of time by emailing them to rticenter@air.org. Tessie will answer your questions that you send in during the online chat, as well as any other questions that come up during the chat. To access the online chat, go to www.rti4success.org and click on Join Our Live Chat. Note that this will not be available until 15 minutes prior to the beginning of the chat. We look forward to talking with you then.